Thanks everyone. So at the moment there's 70 active cases in relation to the Shepparton outbreak. There's been 0 new cases in the last 24 hours, and in the 24-hour reporting period prior to that there was 1 new case. So that's really encouraging news, and of course we hope that that trend continues in the coming days. In relation to the number of people that have been cleared that were formerly considered active cases, that's now 80. So some good progress in that regard. There is a new exposure site, of course, that's been listed late last night in Shepparton. That is the pizza place, and it's in High Street, Shepparton. And the dates that are of concern in relation to that location is the 2nd to the 8th of September, from the hours of 11 a.m. to 11:30 p.m. So that's the 2nd to the 8th of September, 11 a.m. to 11:30 p.m. across all of those days. That's a Tier 2 exposure site, so anyone who's been to that location during that period of time should get tested immediately and stay at home until they get their results. Household contacts aren't required to isolate, but of course anyone who's got symptoms or if you're concerned, in that sense it would be prudent, but there's no requirement for household contacts to do so. In terms of testing locations, the acute respiratory clinic here in Graham Street is open from 8 till 4 p.m, 8 a.m. to 4 p.m. each day, and the drive-through testing is still available at the Shepparton Showgrounds from 9 a.m. to 4 p.m. every day. And again, really in terms of us getting on top of this outbreak and then trying to really squeeze down COVID in terms of its prevalence in the community, the best 2 things in fact that people can do is that anytime you've got symptoms of COVID-19, no matter how mild they are, you should get tested straight away and don't delay, and then of course get vaccinated. So plenty of opportunities for people to get vaccinated. You can book at the state hubs through coronavirus.vic.gov.au or 1800 675 398, and there's not only the state-based hubs but plenty of general practices and community pharmacies that are now able to administer the COVID vaccine. So we're really keen on pushing forward the numbers of people vaccinated right across the country, and it's the most simplest thing that people can do to try and get on top of not only the outbreaks that are occurring at the moment, but from a longer term public health point of view. So happy to take any questions.
That exposure site listed overnight, do you know where that's come from?
Sorry, do I know?
The pizza place exposure site, is that connected to a case that was announced a couple of days ago? Or?
Yeah, so it is a connection, but of course given the nature of being a retail business with potentially a high number of people through there, obviously we want people to really check those dates and times and come forward and get tested straight away if you've been to that location.
Are you concerned about the length of that exposure site?
It is a bit of a concern in terms of, across the period of the 2nd to the 8th of September, it is a number of days, and it's not just a small number of hours that you might see at other exposure sites, that perhaps could be 1 or 2 hours or something like that. To have 11 a.m. to 11:30 p.m, they're big windows of time. So, and of course, the longer those periods of exposure are, the greater the chances are that someone could contract COVID, and that's not what we want. So, people that have been there, please come forward and get tested. There's plenty of access to testing, and there's virtually 0 waiting time across our sites at the moment.
People who've ordered pizza from that place and had it delivered to their house might be asking questions about what this means for them. Is there any advice you have for those people? So
hopefully it's been a contactless delivery. If that's the case, in terms of making sure you're at least 1.5 to 1.5 to 2 metres away, and people are distanced, the food's been put on the ground or on a step in the porch, or a chair or something like that. That's certainly, as long as those distance and the delivery drivers are wearing masks, all of those prudent things that should be done, I think the risk is low. But of course, in the current environment that we're placed at the moment, if anyone's concerned certainly if they've got symptoms, come forward and get tested straight away and don't delay. But that household delivery context, it is lower risk, but of course there's still a chance.
Given we've had 0 cases today, Matt, is it likely that Shepparton will be let out of lockdown sooner than next week?
So the settings and the determinations and decision making around the lockdown is really a matter for the Victorian government, and based on the advice that they receive, it's not something that we GV Health can control. What we can control though is just really, encouraging people to come forward and get tested, isolate, do the right things, and hopefully we can drive those overall numbers down and present that opportunity for government in the future.